If stress has such a potential effect on our patients and clients, not only sexual desire, but actually their sexual pain and sexual functioning, and even general pelvic pain, especially if we're talking about pelvic health conditions that are influenced by hormone levels. We talked last video about how to shift biochemically your patients from stress to sex. And in this video, I want to ask you, what are the best ways to do that, practically speaking, in the clinic? Hi, I'm Jessica Drummond. I'm the founder of the Integrative Pelvic Health Institute. And as a physical therapist and clinical nutritionist, my mission is to help you as a practitioner to be even more effective with using integrative tools to help your patients and clients recover and heal from their pelvic and sexual pain conditions. All right, let's jump right in and talk about how to shift from stress to sex. All right, shifting from stress to sex requires that we help and support our clients and patients in lowering their overall stress load, their physical stress load and emotional stress load. So shifting from stress to sex requires lowering the physical stress load, and one of the first things and most important things you can do is help your patients and clients get off the sugar. Sugar is so inflammatory. In some very recent studies, actually years now, decades of studies on metabolic syndrome, we know for certain that sugar is inflammatory to epithelial cells of the arteries, and contributes to atherosclerosis. So we can extrapolate that. We also have data showing that sugar is inflammatory to gut epithelium, and I would imagine that it's just as inflammatory to pelvic epithelium, epithelium around the bladder, reproductive organs, in the vagina and vulva. So getting off the sugar in and of itself can help lower that inflammation of those delicate epithelial tissues. In fact, when they do studies about oxidative stress, they give the rats sugar to induce metabolic syndrome. So we know that this is pro-inflammatory. And the problem is the volume of sugar that our patients and clients are ingesting. According to the New Hampshire Department of Public Health, about 200 years ago, the average American ate roughly 2 pounds of sugar a year. That's fine. Today, the average American eats roughly 152 pounds of sugar every year. That is so much, and it's inflaming our entire bodies. We just can't take it. So the number one way to shift from stress to sex is help and support your patients and clients in getting off the sugar. All right, number two is a little thing that I invented called the Laptop Curfew. So it's important that we go to bed at a reasonable time every night, but to make that more successful and easier, we have to help our patients and clients stop being on their electronic devices well into the night. That's the goal of the Laptop Curfew. In some recent research out of Japan, it was found that Japanese students who were exposed to blue light, the light that's on our iPads and laptops and cell phones, lowered levels of melatonin, which is a hormone that helps you sleep soundly, 91%. On the other hand, if these Japanese students were given a lovely, grounding, healthy breakfast of protein, vitamin B, and then they were spent some time outside being exposed to actual daylight sunlight and only low temperature incandescent light at night, not this blue light that's such a problem, their sleep improved dramatically, their melatonin levels improved back to normal. So we want to stop this blue light at night by giving your patients and clients, write it down on their prescription, Laptop Curfew, ideally around 8 p.m., a little earlier, a little later, depending on when they go to bed, 8 p.m. with a 10 p.m. goal of bedtime. All right, and the third way we're going to shift from stress to sex today is helping and supporting your patients and clients in starting a yoga practice. And this can be very simple, but it has to be consistent. So in a recent study, women who were considered expert yoga practitioners just practiced once or twice a week for the past 2 years, twice a week of the last 1 year. So a total of about 75 to 90 yoga sessions total over the past 2 years. They were considered expert. The women in the novice group really hadn't practiced yoga much at all, maybe a few sessions here or there. And the women in the novice group, their pro-inflammatory cytokine, one of the messenger chemicals that helps to induce inflammation, interleukin-2, was elevated 41% compared with that expert group. And the expert group was just yoga practitioners once or twice a week on a very regular basis for the last couple of years. They didn't have to actually be able to do a handstand or teach a yoga class. And again, other levels of inflammation were also much worse in the novice group. So the novice group also were 4.75% more likely to have detectable C-reactive protein levels, which is another level of measurement of inflammation. All right, so here's in summary. Today, I want you to take back to your patients and clients that to go from stress to sex, they have to get off the sugar, turn off the laptop, give themselves a curfew at 8 o'clock at night, and start a consistent yoga practice. It doesn't have to be fancy, just twice a week, and lower those inflammatory markers. Thanks so much for being here today, and in the comments below, I would love it if you would tell me what you learned today. What's the #1 thing you learned today, and how you take that thing back to your clinical practice and share it with your patients and clients. If you like this video, please like it and share it with your friends. Great to be here with you today. Again, I'm Jessica Drummond from the Integrative Pelvic Health Institute. See you next time.